somebody creates another way for us to be able to do this, but you know, they may not be fun to do, but actually it's very important for you to get those done. Again, it's not 100% accurate. These are some of the images that we can see when we do mammography. And of course, ultrasound we use in combination with mammography so that we can just better identify and characterize the masses that we're seeing. But of course, it is very limited. This is an example of what that looks like when we get the ultrasound done. A lot of times when we see masses that are more fluid-filled, like this one, that's less concerning to us. If it's got more solid characteristics to it, that is more concerning. MRI, of course, is highly sensitive when it comes to picking up breast masses. The issues with MRI is that they can cost quite a bit more. Also, the other issue with an MRI is that it can pick up things in your breast that may not necessarily be an issue, and then we can end up having more procedures than we need to have. So, you know, we don't start with an MRI, but if we need to go from getting, you know, a mammogram, you know, combined with an ultrasound to better define what it is we're looking at, we will order, you know, an MRI. So that will give us some better insight. But it's almost 100% accurate. So, you know, we definitely use those tools. Then, as far as if there is a lump there, we will typically send you for a biopsy. I'm going to defer all surgical discussions to Dr. Gifford, but essentially that's the process. So with your primary care doctor, we just work with you to make sure that you're moving through those processes. You know, you get your screening. If there's a problem on the screening mammogram, we will get a diagnostic mammogram coupled with ultrasound, and depending on what that shows, if there's a lump or more that needs to be further classified, we can either get a biopsy or an MRI if needed. So we have no guidelines for men in breast cancer per se that we go by, other than to say, you know, it's 1% of breast cancer occurrences. And I've actually had a couple of guys that have come to my practice with breast lumps that we've had to evaluate. So what I would say is talk to your husbands, your sons, your brothers, fathers, and say, look, you're not, you know, immune to this. So if you do feel something abnormal in your breast tissue, please go to your doctor and talk to them and let them examine you and see what's going on there.